Hi, I'm David Klein. I'm an orthopedic surgeon at Kennedy White Orthopaedics in Sarasota, Florida. In this orthopedic moment, I wanted to talk to you about frozen shoulder. Frozen shoulder is the name for any condition that causes stiffness of the shoulder joint, where you literally lose your range of motion. Typically, with a real frozen shoulder, pain is not what's causing it, as the joint actually does have a limitation in its motion. Pain may be the result and may keep you from progressing with getting your motion back. The typical patient with what's called an idiopathic frozen shoulder, or a frozen shoulder that has no outside cause, meaning no arthritis, no fracture, no other significant injury, is female rather than male, typically between the ages of 45 and 65, and commonly having diabetes or having thyroid insufficiency. An idiopathic frozen shoulder is a condition that begins slowly, and then over a period of weeks to months, people realize that they can't reach overhead, they can't reach behind their back, and there are other functions that they can't do because of pain. It will typically cause night pain, and it won't get better through simple methods of taking pain medications, restricting activity, and so forth. As a matter of fact, if you restrict your activity with an idiopathic frozen shoulder, you typically make things worse. If you've lost range of motion of your shoulder, this is something to be evaluated by an orthopedic surgeon. It's sometimes difficult in the early stages to tell the difference between a frozen shoulder and a rotator cuff problem, but as it progresses, motion loss becomes the primary problem with a frozen shoulder. Frozen shoulders can be treated with medication, with exercises, often with physical therapy, sometimes with corticosteroid injections, and failing that, some form of operative treatment. Operative treatment can be a manipulation under anesthesia followed by therapy, or even an arthroscopic capsular release, again followed by therapy. It usually takes several months to get over having a frozen shoulder, even if you're doing all the right things. In summary, if you have a painful shoulder that's lost its range of motion, typically if you have pain in the region of the shoulder, sometimes radiating to the elbow, see your orthopedic surgeon for further diagnosis, and that way you can be helped to get over this difficult condition.